Everything about diabetes is hard.
Diabetes is clearly an epidemic here in Detroit.
Well, 1 in 10 Michiganders has diabetes, but the problem here in Wayne County is even more troubling.
I have to think about it all the time, and I don't like it. I hate it. I hate this disease. Diabetes has been very daunting to me. I was diagnosed, I can't even remember, maybe 13, 14 years ago, and I strongly dislike everything about it. I strongly dislike it. It has changed my life tremendously. I'm probably an example of what not to do. I do the best I can.
It's between them and the diabetes, and one of them's going to win. And the diabetes doesn't take a day off, and the diabetes doesn't get frustrated. So we want them to have the best tools that they can have to help fight, because it is a fight they can win.
It really truly is an epidemic. It's estimated that at least 16% of the population here in Wayne County in the city of Detroit is diabetic. Some of these people may not know they're diabetic, and then there are many, many more who are pre-diabetes. Our effort here in Southeast Michigan through the Southeast Michigan Beacon community is one of 17 communities across the country working on a healthcare quality revolution, and we're doing it through fighting D and the D.
We're here to promote the use of health information technology across the board, from hospital systems to primary care providers. For public awareness and education, we partnered with Team Detroit.
Detroit is a tough town. It's a gritty town. It's taken on a lot of adversity, but it keeps coming back. And that kind of formed the basis of our core idea, which was fighting D and the D. And what that gets down to at the most fundamental level is Detroit will not take type 2 diabetes sitting down. We're going to attack it with the best technology and all the resources we have at our disposal.
Text for Health is a program that allows people to use their cell phones to text the word health to 300-400 to do a diabetes risk assessment. Then, based on that assessment, individuals receive a personalized, customized series of text messages over a 14-week period. They get 3 to 5 messages a week that hopefully elevates their awareness of diabetes and the risks of diabetes, but perhaps more importantly, gives them some helpful hints that they can apply to their lifestyle and hopefully become a healthier person.
Andrea.
Good morning, Dr. Myers. How are you?
Good. How about yourself today?
We partnered with Beacon as a way to help our patients control their diabetes. We've worked with their Patient Health Navigator program. The Health Navigator talks with the patient, helps them to understand the barriers that they might have in their self-care, and looks for ways that they can overcome those barriers. And then more recently, we've been involved in the Text for Health project.
Hi, Glenda. How are you? I'm just calling to see how you're doing. You know, we're living in a time now where everybody's texting, where they can text their information in there, and on a daily basis, they're getting information. You know, people that don't know that they're diabetic, and they put certain information in there, then that will send them back a message, you know, well, I think you maybe need to see the doctor, or it gives them good information, you know, to see about themselves.
Text for Health is really important because it gives friendly messages in a more informal environment for our patients. So they come and they talk with the doctor, and that's kind of a scary thing, but then they can get texts at home that just kind of help keep in their mind the things that they should be doing to help fight this disease.
The doctor felt like I was a real appropriate candidate for the program because even though I knew a lot about diabetes, I wasn't tying it together. That led me to being referred into the Beacon program. That's where I met Ms. Jackson. And then, you know, I liked the program. And I think the thing that impressed me was that Ms. Jackson herself has had diabetes and has gone through the struggle of diabetes.
I'm
well. How about you?
How you doing?
Doing good.
You okay?
Doing good.
When I got the call from Schuler, and he wanted me to come and meet with him, I just started jumping for joy. to have a patient to call you back and request you or request some kind of service from you concerning their diabetes. That is a big blessing.
I think diabetes affects all of us in one way or the other. It's such an epidemic now. It seems like more people are affected by diabetes than probably any other disease.
About 10% of our population in Michigan has diabetes. This is a very serious problem. When you think about the fact that at the root cause of type 2 diabetes is obesity, we are among the top 10 states in the country that have the highest obesity rates. We have 2.5 million Michiganders who are obese and 400,000 children who are obese. Diabetes, it's a very debilitating disease, and it can end up in creating blindness, in people losing limbs, and creating many other secondary illnesses. So it's very devastating to the individual, to the family, and it's also very costly. And the good news is that if we take care of ourselves, we can prevent it. We look forward to continuing to partnering with Beacon and work together on getting Michigan healthy. And I know this is a doable goal, an achievable goal, if all of us work together, if all of us engage.
Text for help! Text for help! Text for help!
We engaged at a grassroots level to get the word out about fighting D in the D. Over the course of time, we spent over 1,000 hours on the streets of Detroit communicating this message. At the same time, we created a series of posters and tent cards and a lot of different types of promotional materials that we handed out to local businesses. What we did is we determined where people were spending the majority of their time, and what we found is that laundromats, beauty salons, bus shelters were where people spent a great deal of time. And so we targeted those areas, as well as banners on buses and within buses, to communicate the Fighting D and the D message. We started with a press event at the Book Cadillac, invited the Surgeon General to come in town, and invited the press as well as local major healthcare providers, faith-based groups, physicians.
It's important also to know that health doesn't occur just in the doctor's office. It occurs where we learn, where we work, where we play, and where we pray. So we have to get people involved in the community to start to take control of their own health. And our role is to give them the tools and the information that they can make good health decisions.
That really became the launching pad for the campaign.
Health should be enjoyable, it should be fun, it should not be hard. And so we need to take our public health messages and our public health information to people and to them where they are. And one way to reach them is through their cell phones or their smartphones. And so the Text for Health is one of our approaches of doing that, to get a message right back on a regular basis about your own health, personalized to you, get you involved in how you can be healthy.
It is not something, it's not a death sentence. You can live with it, but if you don't, if you're not aware of it and if you just determine not to do anything, it's going to kill you.
Being educated, knowing what to do with your disease, it makes the world of difference. And to go out and to reach the people, and to encourage them to do better about their disease, it makes my heart glad.